Hello everyone, I am Dr. Sandeep Manan, your anatomy faculty, and let us discuss one PYQ, previous year question. Now when it comes to PYQ, some students have this concept in mind that PYQs are very important. There is no denial about that. PYQs are very important, but we have to understand that we all know that questions are repeated in the exam, but it is not always the questions which are repeated. Okay, most of the time it is the topics which are repeated. Okay, so because sometimes some students, when they read these questions, like this patient is having history of pain in both legs while talking long walk, he has developed the toe gangrene, and he admits to have erectile dysfunction as well. So basically he is having the difficulty or some type of pathology involving both the lower limbs and also the pelvic part. That is what we can understand at anatomical level. And which of the following artery is involved in this patient? So this is bilateral lower limb involvement and also the pelvic involvement. So either it is the involvement of both the common iliac arteries, because we know, let us look at the anatomy part. Let me show you this. Here we have the abdominal aorta. This abdominal aorta will bifurcate into two common iliac arteries, and common iliac arteries will bifurcate further into external and internal iliac arteries. So we have these two external iliac arteries which are going for the lower limbs, and these two internal iliac arteries which are coming for the pelvic viscera. So basically this particular pathology is possible. Either there is bilateral involvement of common iliac arteries, which is relatively less likely. It can be possible, but more likely it can be a central lesion. Some central occlusion has taken place. Because of that, the patient is having the bilateral lower limb involvement, also the pelvic involvement. Now this will lead to the answer, that is D, ioto-iliac junction. But as I said कि कुछ students इसको सिर्फ PYQs को समझेंगे कि हमारे लिए important है, तो हमने question और answer को याद करना, ऐसा नहीं है. We need to know the question and answers, that is definitely required. But more than that, what is PYQ का बाप? PYQ का बाप means we need to know the related topics as well. Okay, the related topics as a whole, the concept should be clear, because we now need to know internal iliac arteries branches from the anterior division and posterior division. In itself, it's very important question, and if you see over the last few years, various number of times the question has been asked on this topic as well. So now this is the whole idea that we will be doing PYQ ka Baap series, which is starting on 13th, which will be up to the 17th of Feb, and it will be on eMedicoz app, DAMS eMedicoz app, and I will see you over there, right? Thank you very much.